Hello, everyone. Thank you for joining the Income Security Advocacy Center's presentation as a part of Disability Without Poverty Symposium. My name is Asif Khan. I'm the Research and Policy Analyst at the Income Security Advocacy Center. Today, I'll be presenting the findings of our research on Ontario Disability Support Program recipients, which aim to better understand how people experience the program, their challenges, perspectives, and what the findings tell us about the needed policy changes. The title of my presentation, as written on the first slide, is Systematic Failures of the Ontario Disability Support Program, Recipient-Driven Evidence for Urgent Reform. In the next slide, we discuss what is the Ontario Disability Support Program, or ODSP. ODSP is Ontario's primary social assistance program for persons with disabilities. ODSP operates alongside Ontario Works within the province's social assistance framework, but is designed specifically for those whose disabilities create unique barriers. Nearly 500,000 low-income Ontarians with disabilities rely on the program for income support, and it has two main components: basic needs to cover food, clothing, and personal items, and shelter allowance for covering housing costs. The ODSP amount that one receives is personalized and calculated based on financial situation and household details, but for a single Ontarian with disabilities, the current maximum monthly amount is $1,408. Moving on to the next slide, where we share details on the purpose of the study. The purpose of our study was to center the voices of Ontarians receiving social assistance. While we focused on both Ontario Works and ODSP recipients, in this presentation, we'll only focus on responses of ODSP recipients. With the study, we wanted to hear directly from Ontarians on ODSP about their lived experiences with this crucial program and to understand how well it supports their path towards financial security. Overall, the study aimed to amplify the voices of ODSP recipients, many of whom are from marginalized communities, including Indigenous, racialized, and newcomer groups, and to build a data-driven case for reforms that promote dignity, equity, and self-sufficiency. This recipient-led approach ensures our findings are grounded in real-world impacts. In this next slide, we present the methodology of the study. The study was conducted through an online survey via SurveyMonkey between October 21st and November 24th, 2024. We promoted it through social media, community networks, and partner organizations to maximize its reach. While the survey was designed primarily to capture quantitative data, there was also room to gather some qualitative responses to add personal narratives. All responses were collected anonymously. Overall, we received 248 complete responses, 151 of which were from ODSP recipients from across the province. Continuing with methodology in this slide, we used a mixed methods approach for the study. That means we combined quantitative elements like income brackets and 5-point satisfaction scale with qualitative open-ended questions about spending priorities and ideas for reform. For the analysis, we applied descriptive statistics such as median and percentage and conducted a thematic analysis to identify key patterns. For example, common concerns around rising costs and clawbacks. We also ran demographic cross-tabulations comparing, for example, experiences in urban and rural areas, which helped us add more depth and context to the findings. The questions of the approximately 20-minute survey primarily captured data on demographic profiles of the respondents, their use and adequacy of ODSP income, employment barriers, experience with ODSP service providers, and suggestions for program improvements. Moving on to the findings of the study, starting with demographic information. On this slide, there are two pie charts showing residential and household types of the participants. We found that most participants, about 62%, lived in large urban centers such as Toronto, Ottawa, and Hamilton. Another 16% lived in medium-sized communities, while rural areas made up the smallest group at 9% of the respondents. In terms of household type, the majority, about 71%, were single individuals, followed by single parents with children, who made up 16% of the respondents. In terms of gender identity, which is presented in a pie chart in the next slide, cisgender women represented the largest group at around 61%, followed by cisgender men at about 30%. When it comes to legal status, presented in a pie chart, Canadian citizens made up the vast majority, about 88% of the respondents, followed by Indigenous participants, who represented about 9%. The data on income status of the respondents are presented in a bar graph in this slide. We found that 62% said that they earned under $20,000, and a striking 83% had household incomes under $30,000 overall. So the data here reveal deep levels of poverty among ODSP recipients. Let's move on to the next slide where we present how participants actually use their ODSP funds. The data is presented in a bar graph. As the graph shows, ODSP income is entirely devoted to basic needs. Nearly 90% of the respondents said they always use it for rent or housing, 77% always use it for bills, and about 71% always for groceries. Transportations at about 57% and uncovered health needs around 53% also rank high. Overall, the data shows that recipients are prioritizing essentials over anything else. Now on to the next slide. When we asked about the recent inflation index ODSP rate increase, most respondents said it made little to no difference. Including the responses in the other category, about 67%, that is 101 people, reported no meaningful change in their purchasing power. Only 7% said the increase helped in any real way. When we looked at the open-ended responses, the reason became clear. Many said the increase was immediately eroded by rising costs, especially rent and food. One respondent put it perfectly, which we put on this slide, quote, "My rent has gone up each year. In 2025, my rent will go up another $60. So the $40 extra I get in ODSP isn't even covering my rent increase." End of quote. We also asked recipients what level of income would actually meet their needs. As the next slide reveals, on average, people suggested an increase of about $1,500 per month, bringing total ODSP amount to around $3,000 a month. The median, mode, and mean are not far off from each other, all lined up around that figure, which shows that people have a realistic understanding what it actually costs to live with dignity in Toronto or Ontario today. These are not extravagant numbers, they're practical, evidence, and need-based. Moving on, in this slide, we present in bar chart format how recipients would spend their benefits if the rates were increased. Over half, about 52%, said they would first spend more on food and groceries. About 38% said they would put toward housing. Another 15% would use it for uncovered medical needs. Employment continues to be a major barrier for ODSP recipients, as we present in the bar graph in this slide. Almost half of the respondents said they can't work because of their disability. Only about 1 in 5 or 20% are employed, and most of them are working part-time. When we look at those in the lowest income group, earning under $20,000 a year, a much higher percentage, about 61%, reported not working at all. What's also striking is the inverse relationship between disability and income. Those who earn more are less likely to cite disability as the main reason they're not working. This suggests that if their disabilities did not limit employment, recipients would likely be working more and probably not have to rely on ODSP to meet their basic needs. Next, we asked about the experience with ODSP offices. As presented in these two bar charts, overall, Courtesy and customer service quality were rated moderately. About 61% of the respondents agreed that they were treated with courtesy and respect, while 20% disagreed. Similarly, 63% felt their service experience was free from discrimination, while 16% disagreed. When it comes to timeliness, responses were more mixed, as we present in a bar chart in this slide. Delays appeared to be a common issue. About 34% reported negative experiences, suggesting that many recipients face challenges in getting services within a reasonable time. Access to services also varied, as presented in another bar chart in the slide, with roughly 30% sharing negative feedback. Moving on to the bar chart in this slide, information access stands out as a particular area of concern, with the highest negative rate at 33%. Likewise, overall satisfaction levels with the services were mixed. Around 1 in 3 respondents expressed dissatisfaction. This means that many recipients feel ODSP services are often falling short of expectations. We also found important equity gaps. Rural recipients report more issues. About 46% had negative experiences with information access compared to 33% overall. Among indigenous respondents, negativity was even higher, up to 58%. These figures point to systemic barriers in service delivery that disproportionately affect marginalized communities. Moving on to the next slide, we calculated an overall satisfaction score using a weighted average where responses like strongly agree or disagree were assigned values on a 5-point scale. The findings are presented in a bar chart here. ODSP's satisfaction scores range between 3.14 and 3.52, roughly a B plus at best. However, compared to Ontario Works recipients, satisfaction among ODSP recipients was about 0.3 points lower on average, showing a more negative experience. Altogether, these results reflect the broader systematic challenges that ODSP recipients continue to face, particularly those in urban and indigenous communities. Next, we asked the recipients about the important question, what should the government do to improve ODSP? We received open-ended responses from ODSP recipients, sharing their direct feedback on what changes would make the program more supportive and equitable. Their answers were then grouped into 7 main themes, as presented in the bar graph here, ranked by how frequently they appeared. It was quite obvious that the majority called for increased financial support, followed by eliminating clawbacks, better housing, stronger health supports, simplified administration, and more respectful and dignified treatment. Let's unpack a few of these key recommendations. First, the most dominant theme shared by over half of all the respondents was the call for increased financial support, which is presented in this slide. Recipients emphasized that the current rates simply do not keep up with the cost of living. As one person put it, quote, increase the amount so that people don't have to choose between rent or food or electricity, end of quote. The second major theme presented in this slide, raised by about 18%, was the need to remove or reduce clawbacks on employment income, spousal income, and federal supports. Recipients felt that ODSP should encourage work and relationships, not penalize them financially. As one respondent wrote, quote, no clawbacks on income until you're over the poverty line, end of quote. Third, moving on to the next slide, as we present in this slide, around 17% of the participants called for improved housing supports. Their feedback focused on increasing shelter allowance to reflect market rates and providing access to subsidized or emergency housing to prevent homelessness. In the next slide, we summarize what we heard from the ODSP recipients to the survey. It's clear that the current ODSP rates are not enough. They are quite inadequate. Over 82% of the respondents reported living in households earning under $30,000 per year. Recipients told us through the survey that they're using all of their ODSP funds just to cover basic necessities, with nothing for uncovered medical needs or even clothing. The recent rate indexation had no meaningful impact. Inflation and rising costs quickly eroded any benefits. So we heard loud and clear the call for a substantial increase to ODSP, with many suggesting a $1,500 boost or a doubling of the current rates to reach something closer to a living income. Second, the data also point to how inadequate ODSP rates can perpetuate cycles of deprivation. About 71% of the respondents prioritize spending on food to fight severe food insecurity, and 90% use their ODSP incomes for housing to avoid homelessness. These are low rates, and they don't just limit opportunity, they drive public health crises, including chronic illness, hospitalization due to poor nutrition, and worsening mental health. To put it in perspective, studies estimate that the average healthcare cost of homelessness is over $12,000 per person annually in Toronto only. Instead, investing in adequate social assistance like ODSP could prevent these downstream issues, reduce reliance on costly emergency care, and help build healthier, more stable communities, ultimately saving taxpayer dollars. Third, we heard strong feedback about clawbacks and asset limits. Respondents specifically urged the government to eliminate clawbacks on earnings and benefits so that recipients can work or receive support without being penalized. Half of the ODSP recipients told us they can work due to disability, yet they face restrictive asset limits and deductions that deepen their insecurity. Based on the findings, we strongly recommend removing clawbacks on income support, eliminating the $10,000 cap on voluntary gifts, and raising liquid asset limits to $100,000 so that recipients can save for emergencies without being disqualified. Moving on to the next slide. A B+ rating in service delivery is good, but improving timeliness and accessibility could make a huge difference in the lives of the province's most vulnerable in need for support. The government should focus on training caseworkers in trauma-informed services, reducing discrimination, and making communication clearer for the clients. For Indigenous and rural recipients, culturally sensitive staff and regional outreach are essential to bridge the access gap. Finally, the data reveal that poverty is deeply interconnected. Food insecurity, health barriers, and employment exclusion all reinforce one another. These findings point to the need for a comprehensive poverty reduction strategy in Ontario with explicit targets for disabled and all Ontarians. For example, the government must set a target like cutting poverty by 50% by 2030 through coordinated investments that tackle root causes, not just symptoms. That brings us to the end of the presentation. Thank you for your time and attention. For any questions about the study or the presentation, feel free to reach us. Our email is info@isac, that is isaac.clcj.ca. You can reach us on phone 416-597-5820, and our toll-free number is 866-245-4072. Have a wonderful day.